Hi, welcome to Chapter 17, Physical and Cognitive Development in Late Adulthood. In this chapter, we're going to look at variability in late adulthood, physical changes, mental health, and cognitive changes. These are the objectives we'll be covering. First of all, a centenarian is someone who has reached the age of 100 years old or more. It's the fastest growing population segment of the United States and also in developed countries. Currently, there are 60,000 centenarians in the United States. There may be over 800,000 American centenarians by the year 2050. This is a general trend worldwide, especially in higher income nations. And there's a nice video here on a life expectancy calendar. Click that link to find out how old do you think you'll live, and a nice little video on centenarians. Gerontology is a study of scientific aging, or scientific study of aging. The life expectancies of males are around 75. Females, it's around 80. This increases as adults get older. For instance, if a man reaches the age of 65, his life expectancy goes up to 80. And if a man turns 80, it goes up to 90. A 65-year-old woman can live to 85. White Americans who are 65 to 74 years old have a longer life expectancy than African Americans of the same age. By the age 75, life expectancies of whites and African Americans are about the same. Your book talks about subgroups of elderly. There's what's called the young old. That's from 60 to 75. Your old, which is 75 to 85, and the oldest old group, which is 85 and older. Now, the oldest old is the fastest growing segment of the population. However, when you reach that age, you're going to suffer from more physical and mental impairments than any other age group. That's one of the joys of getting old. There's going to be a coming demographic crisis. In 2008, Social Security pensions exceeded income from Social Security taxes. Now, options are to decrease benefits to recipients or to increase taxes to workers. Now, public really opposes both options. However, other options have been suggested, like one, raise the cap of $118,000, which means a person who makes $118,000 will pay the same amount of Social Security as someone who makes $118 million, because once they get over that cap, they do not contribute Social Security taxes. The public wants autonomy over investments, which pushes what's called the privatization of Social Security. But then the other side wants guaranteed retirement income, which says let's not privatize it. Let's just increase how much or who contributes. Without a solution, your book says that bankruptcy may occur. Not necessarily bankruptcy, but by the year, what was that, 2035, only 78% of payouts would be able to be afforded. So they're either going to have to lower the benefit or increase the amount or raise the cap. But those are all easy solutions. Either put more money in or restrict how much money goes out. How will these decisions affect you, your parents, your grandparents? You decide. What's more important, having autonomy over your Social Security taxes or having a guaranteed income that's there for you no matter what, regardless of how the market is doing. Let's talk about self-rated health. If you look at the overview, is most elderly rate their health as good. Despite health challenges, elders remain emotionally resilient. Adults with cardiovascular disease and Alzheimer's disease show earlier declines in mental abilities. And there's a little video here on active seniors. Next, I'm going to show figure 17.1, page 420 on health. Most older adults will rate their health as good. Health is a single factor affecting physical and mental states over time. Despite any experiences with disease and disability, elders remain emotionally resilient. Adults with cardiovascular disease show earlier declines in mental abilities, as do those suffering from Alzheimer's. If you notice here, the percentage of people 65 or older with respondent assessed good to excellent by age group and race and Hispanic origin. Notice that non-Hispanic whites tend to have a higher percentage of reporting good health. There's some limitations on activities as you get older, what's called your ADLs, or your activities of daily living. That's basically being able to feed yourself, to use the restroom, clean yourself. Then there's instrumental activities of daily living, and these are the more complicated, intricate type tasks, like managing your checkbook and stuff like that. The rise of disabilities with age: 50% of people over the age 75 have difficulties with their regular daily living activities. So a disability is a limitation in an individual's ability to perform certain roles and tasks, such as problems with daily living chores and self-help lead to labels of disability. Page 421 is that figure 17.2 to see the numbers of elderly who have problems. Now, normally disabilities rise with age. Half of those over the age 75 have some disabilities. Arthritis and hypertension are the most common. Women are considerably more likely to suffer than men, are more likely to suffer from arthritis. The rates of disability among the old, and oldest old have declined in recent years. And when we're talking about ADL, activities of daily living, that'd be like bathing, dressing, using the toilet. Where IADL has instrumental activities of daily living, that'd be like your money management. Figure 17.2, page 421, indicates chronic conditions such as these that often interfere with an older adult's daily life. Notice the most common is hypertension and arthritis. Let's look at some late adulthood across cultures. There's a high level of variability. It's good to excellent health ratings. Women are considerably more likely than men to suffer from arthritis. Percentage of sufferers with arthritis: 58% of elderly whites, 50% of elderly Hispanic Americans, 67% of elderly African Americans. Identical twins are more similar in length of life than fraternal twins, which shows the biological component. Adults whose parents and grandparents were long-lived tend to live longer, and long-lived individuals have lower rates of chronic illnesses such as diabetes. So does health matter? Yes. Smoking, low levels of physical activity, has been being significantly overweight or underweight increases risk of death. Exercise keeps people healthier. The most crucial variable is physical exercise. Even over the age of 80, exercise leads to motor skill development and muscular strength. Exercise can prevent height loss too. Eating patterns are critical for health, especially calorie restriction. Alternate day fasting and calorie restriction influence aging and longevity by reducing individual overall metabolic rate. This chart shows 4 main changes between the ages of 60 and 90. Adults with higher levels of education show significantly less atrophy of the cerebral cortex. Reaction time increases for everyday tasks such as synaptic speed. That slows. The loss of neurons occurs, but they are not as critical for cognitive function as was once believed. Plasticity also decreases and reaction time increases. For vision, there's something called presbyopia, which is farsightedness. This increases with age. Blood flow to the eyes decreases, enlarging the blind spot and reducing the field of vision. Vision loss has greater negative effects on an elderly adult's sense of well-being than it has for other ages. There's more difficulty with night vision and responding to rapid changes in brightness. Usually cataracts become more common, and that's the lens inside the eye becomes clouded. Also glaucoma and macular degeneration. Men work in environments with higher noise levels, so they tend to have a higher degree of gradual hearing loss. Auditory problems are thus more experienced by men. Frequently, problems include less ability to hear high-frequency sounds. Older adults develop difficulties with word discrimination, listening with background noise. Noisy conditions hamper hearing for the elderly. Tinnitus is persistent ringing of the ears. This also increases with age. Hearing aids can improve many elders' quality of life. The ability to sense the 4 basic flavors does not seem to decline with age, but less saliva is secreted, and elders report that flavors seem more blander. This may be due to the loss of the sense of smell. The sense of smell does deteriorate with age. Loss is far greater among elderly men than among women. The skin of elderly adults is less responsive to heat and cold as well. Let's talk about then biological aging with longevity. You have what's called the lifespan, which is the maximum amount of years that humans seem to reach, and that ranges from 110 to 120. This is different than life expectancy, which is the average amount of years that somebody lives. Now, each chromosome in the human body has at its tip a string of repetitive DNA called telomeres. And what the Hayflick limit is that each species has a time limit beyond which cells simply lose the capacity to replicate themselves effectively. This genetic limit argument is where there's a timekeeping mechanism and for the organism, and the number of telomeres reduces slightly each time a cell divides, and there may be a crucial number of telomeres, and if the number is too low, disease and death follow quickly. Now, telomeres is a region of repetitive DNA at the end of the chromosome, which protect the end of the chromosome from deterioration. Other theories to consider are what's called genetically programmed senescence. And this is where there's a gradual deterioration of body systems with age. Another one is where aging genes are equipped with a built-in clock, preventing genes from having aging effect with reproductive years. And then the last one is where genes switch on after the reproductive peak passes, that causes the body to slowly decline. More theories to consider are the repair of genetic material and cross-linking. Cross-linking is undesirable chemical bonds formed between proteins or fats. Collagen and elastin from cross-links, the resulting molecule can't assume the correct shape for proper functions, leading to effects such as wrinkling or arterial rigidity. Next is free radical theory, and there's antioxidants can inhibit the formation of free radicals and promote chemical processes that help the body defend against them. Free radicals are molecules or atoms that possess an unpaired electron. Oxygen-free radicals, they enter into many potentially harmful chemical reactions. They cause irreparable cellular damage that accumulates with age. Antioxidants can inhibit that formation of free radicals. If you eat foods high in vitamin C, E, and beta-carotene, they're typically high in antioxidants, which could lead to a longer life and lower rates of heart disease as well. Next is the terminal decline hypothesis. And this is that significant declines occur within a few years of death. Longitudinal research supports a general loss of functioning that slowly occurs throughout older age. However, there are significant declines that are part of the dying process. They usually occur within a few years of death. It leads to significant drops in functioning before death, but only changes in cognitive functions that seem to support terminal drop hypothesis. Next is general slowing. First of all, there's the dendrite loss in the brain, loss of muscle elasticity, and there's a decline in the speed of nerve impulses, which is responsible for difficulties translating thoughts into actions. And then there's changes in temperature sensitivity. Changes in sleeping patterns creates, you may wake more frequently at night, show less REM sleep. You tend to wake early in the morning and go to bed early at night. Changes in eating patterns is the ability to regulate appetite. Changes with age. There's a loss of feeling of what satiety. Thus you'll overeat. In other words, you don't feel full, so you keep eating. And they may become rigid at meal times and food selection to compensate for that. There's reduction in stamina, dexterity, and balance. That loss of balance is associated with a higher risk of falling. Activities such as golf or Tai Chi may help with this balance. There's more problems with fine motor control as you get older. It impairs the rate at which older adults learn new skills, such as computer or mouse type activities. Next, sexual activity. There's a decrease in sexual activity as you get older, and that has many causes. First is the continued decline in testosterone. Certain medications or physical pain may affect sexual activities. Stereotypes that portray old age as asexual. However, 70% of young, old, and about half of old people continue to have sex. Women may be even more sexually adventurous as they get older, probably because they don't have the pressure or fear of becoming pregnant. Alzheimer's disease is also what's called neurocognitive disorder due to Alzheimer's. This is a very severe form of dementia. The early stages become evident very slowly. Usually there's like subtle memory difficulties, repetitive conversation, disorientation in unfamiliar settings. The memory for recent events begins to go. Memories for long ago events and well-rehearsed procedures are the last to go. Eventually, sufferers may fail to recognize family members, they forget names of common objects, and forget how to do routine activities. As the disease progresses, more declines appear. Declines in ability to communicate, inability to control eating habits, difficulty processing information about others' emotions. Displays of anger and inappropriate outbursts also increase, and also depression increases. Diagnosis is difficult because 80% of the elderly complain of memory problems. Usually you can't really prove it until you have what's called an autopsy, where the presence of neurofibrillar tangles and plaque deposits show up in the brain. Now, there's what's called a mild cognitive impairment and Alzheimer's disease. It's no specific disorder that counts for symptoms like brain tumor, stroke, and depression. There's usually a gradual decline in cognitive function along with low scores on standardized tests. There's what's called mild cognitive impairment. It's more common, affects 1/3 of older adults. It's usually the precursor to Alzheimer's. It's confirmed by brain imaging and DNA studies. And then there's what's called age-associated cognitive decline. In other words, this is just normal cognitive decline as a result of getting old. 10% of those in their 70s, 25% of those in their 80s experience age-associated cognitive decline. For Alzheimer's disease, popular treatment is galantamine, which is increases in amounts of some neurotransmitters. They can slow the progress of this disease. Use of anti-inflammatory medications such as aspirin. Training in use of specific everyday strategies and tasks can also improve memory. Genetic factors appear in some, but not all individuals. Chromosome 19 controls a particular protein, which leads to dendrites and axons becoming tangled. The age of onset is highly variable, anywhere from 44 to 67 years old. There's wide variations in severity of behavioral effects of the disease. True or false? Dementia is a symptom, not a disease. It involves a different process than does Alzheimer's disease. Correct answer is true. There's a little video here on Alzheimer's and dementia. So dementia is a symptom, where Alzheimer's is more of a disease. That dementia is a symptom. Dementia can have many causes. There was what's called they may appear after multiple strokes or multi-infarct dementia. Dementia has various causes. Many forms involve irreparable brain damage. It's important to have careful physical examination. And different forms of therapy can improve function. Prevalence and demographics of depression. Older adults are at greater risk for depression. The full story of late adulthood depression is complex. Roughly 14% of 65 to 69-year-olds and 19% of those 85 years and older suffer from depression. It's more common among less educated adults, regardless of other factors such as ethnicity. Computers are a new form of technology that can become increasingly important in the treatment of neurological disorders. There's speech rehabilitation programs, there's virtual reality programs. They can help route learning in a virtual environment. Now, if you worked in a rehabilitation facility and had to convince a technophobic older adult to participate in a computer-based program, what strategies would you use to persuade the patient to give the new technology a try? How do you think computers might be useful for older adults who complain of everyday memory problems? So here the computer can actually be a real helpful tool. Now, risk factors in depression are very similar to risk factors in depression for anyone else. Therapy and medications are the same for older adults. They may benefit from psychotherapy that stresses optimism as a coping strategy. Now, the risk factors are inadequate social support and income. Depressed women outnumber depressed men 2 to 1. Women respond to accumulation of everyday stressors. Men respond to traumatic events. Poverty puts elderly at high risk. Emotional loss or absence of significant others. Persistent health concerns are the strongest risk factor, the more disabling the condition, the more depressive symptoms the older adults display. Now, in general, minorities have less education, greater poverty, and worse health. Mexican and Chinese American immigrants suffer from poor English skills, and this is correlated with depression. African Americans may have lower rates of clinical depression. However, they may also be underdiagnosed. This may reflect beliefs that depression is a spiritual problem, not a mental state. Now, while older white men have the highest suicide rates increase in older men with age, but remain stable in women. Older men have several risk factors that may lead to them to commit suicide. One is the loss of economic status. That may trouble men more. The death of a spouse plays a huge role for men. The idea is that one is a burden for others, especially if health is poor. That could put a person at risk for loss to suicide. Gender differences in suicide, figure 17.3, page 432. The data on which this figure is based indicate that suicide rates increase substantially in old age among men, but remain fairly stable among women. See figure 17.4, page 435. Forgetfulness increases as we age. Short-term memory capacity begins to be a problem, especially when handling multiple tasks. Responses that require cognitive speed show greater decline. And strategy learning helps older adults improve memory functions. Your book suggests that the learning process will take longer as well as a result. Figure 17.4 talks about the percentage of memory problems as older adults age. And notice the older you get, the more reported memory problems. So where are those dang car keys? Remembering points of a newspaper article, recalling movies, conversations, grocery lists, whether they did something, medicines, all examples of everyday memory tasks that show decline with age. Virtually all everyday memory tasks decline among older adults compared to younger adults. It's been demonstrated in longitudinal and cross-sectional research, especially those over 70. Prior knowledge is a critical factor in memory functioning. The loss of speed is a key aspect in the process of memory decline. And here's some videos here on cognitive impairment in memory and exercise. Notice in this chart, this graph shows the results from the West in Crook's classic study of memory for telephone numbers. Notice that there's no loss of memory in middle adulthood for the most common condition. A 7-digit number dialed immediately. But if the number of digits increase, or if you have to remember a number a bit longer, some decline in memory, which begins around age 50 or 60. And now I'm feeling it because I've already been reassigned a 10-digit phone number, and it's taken me forever to remember it. Okay, figure 17.6, the learning process simply takes longer for older adults. More time is needed to create the mental image and to link that image up to the word in the list. Let's talk about wisdom. It's essential to solving practical life problems. Complex answers are rated as being higher in wisdom. Young adults perform as well as older adults on fictional tasks. Wisdom may not be a defining characteristic of the elderly. Finally, there's a Gene Cohen stage theory of midlife to late life creativity. First of all, is a reevaluation phase, and this is the 50s, where you reflect on past accomplishments and formulate new goals. The liberation stage is it's in your 60s. You're freer to create, to be more tolerant of failures. You're willing to take more risks because of your age and you're close to retirement. And summing up, in the 70s, there's a desire to knit accomplishments together in a cohesive story. There's the encore phase, which is around your 80s, and that's where your desire to complete unfinished work or fulfill desires. Maybe think about what is your bucket list and what would you like to accomplish. This completes this unit. Everybody have a great week.